es la clínica para
¿Cómo se dice? ¿Cómo te llamas en el idioma sur?
Líder.
¿Líder? No,
Líder.
Hola.
My work is fundamentally ethnographic. I spend time with families, I learn from families, and this is where we have to start off from. I am not there to play the expert. I am no expert. Disabled people and people living in conditions of extreme poverty, those are the real experts in their own lives. What we do is not missionary work, it is activist work. This is what I believe in, this is what I try and fight for, the ability for people to wake up in the morning and decide I want to be this and to have the freedom to do it. Is this project charity-based? No. This is about working together with families and with communities and with disabled people's organizations to access one of the most basic human needs, which is decent, quality, sustainable healthcare. My work has been largely focused on Guatemala and the global south over the past years. We work together with disabled people in conditions of extreme poverty to be able to access emergency healthcare. The situation is really critical in Guatemala. There's huge levels of poverty, and Guatemala is also one of the most unequal countries in the world, which means that there's extreme unequal distribution of wealth on all levels, and this means not only monetary wealth, it also means access to services such as health and education. Then you've got other critical factors like distances and people not even being able to cater for the costs of transportation to be able to reach a healthcare facility. The enormous inequality goes back to colonial times, the way land was appropriated and then the way it was not distributed, appropriated again as decolonization occurred. There's so much discrimination that is perpetuated on the basis of racial inequalities. So you've got the indigenous people who remain the poorest of the poor. Those people who are confined in rural areas are particularly disadvantaged. You've got a healthcare system that sometimes, as I have witnessed in my work, is not always very safe. And I think it goes down to the basic mindset that people in extreme poverty are very often not treated with the respect that they deserve. And I think this is where people in extreme poverty sometimes are treated as disposable human beings. The people who can afford would opt to use private healthcare. What happens is that even the one that is free, even if it is sometimes unsafe, is very often not accessible to the poorest people. So you've got people suffering sometimes the most serious of conditions in very isolated rural areas. We also work with people who have never, for example, been to a doctor in 15 or 20 or 25 years, who don't even know what their impairment or their condition is.
No sé si están de acuerdo. No tiene ningún riesgo ni nada. Nada.
Guatemala in particular helped me to remain grounded, and that is really important, where my academic work is grounded in practice. It is not purely theoretical work from a distance. Real action research. I'm extremely tired of an academic world that is full of sedentary academics and sedentary human beings very often, where their academic work is the be-all and end-all of their complete academic and very often sometimes existence as well. I need to be in the field to inform my academic work and being aware of what is happening outside our own country in other geopolitical spaces. Interest is the most basic help. I need to learn, I need to continue learning. This is not a charity project. The way it is being operationalized is very much as a rights-based project. It is not only participatory, it is locally owned. So this project will eventually, and it already is, being steered by local level partners, specifically by disabled people's organizations on the ground. These are not beneficiaries These are partners. We do the project together, so it starts off with organizations coming in with their own priorities. They also provide very important cultural mediation, because it's not only about language, it's also about there's so much effort that goes into learning how to relate, how to interact, and how to pick up certain cues. Positive experience is actually seeing people being treated with the dignity that they deserve. The people we are working with are obviously the poorest, and to have people get fantastic healthcare at a fraction of the cost. What I really want is for this work to have a legacy and to persist over time. I don't want to keep on doing this work on my own. I would like more people to be inspired to do this work. This is something that needs to be done. This is about people not having to suffer the brunt of poverty the way that they do, of people having access to the most basic needs, to be able to really live their rights, of knowing what their rights are. This is about people living with dignity and the respect that they deserve. This is what this project is about. This is the little contribution I want to give to this life. This is what I want my life to be about.